Hello, and welcome to another day of living with spina bifida. I've been having a substantial amount of physical pain today, mainly in my right hip. So I thought today would be a good day to talk about pain management and how I personally deal with pain on a day-to-day basis. For me personally, pain is just something that I'm used to. It's never not there. It never goes away. Sometimes there's just different pains. Sometimes there's just days where the pain is worse. For the most part, it's common for me to have headaches, even migraines. So those are just always there. And once in a while, if I don't have a headache, I still have pressure and the floaty feeling of a headache coming on. And sometimes it just takes a couple of days for the headache to show itself. And then usually I will have neck and shoulder pain because of my spine being curved. So then my shoulders are uneven and it puts a lot of pressure, especially when I'm using my wheelchair and whatnot. So my muscles and whatnot are always hurting. And also, depending on what I do in my day, I will have back pain, knee pain, and like today I will have hip pain. And like I said, for me, it's just a thing that I deal with. I just kind of let it be. I take it in and just accept it as part of me. But there are days where that's not possible, especially the days where there's extreme pain or pain that I don't normally have. I'm not as used to it, like my hip pain. I'm not as used to it, so I have to deal with it a little differently than just ignoring it. But usually a hot bath, a little soap, and a heating pad will do the trick for muscle pains and joint pains. But sometimes those don't work, so you need to get some medications or different creams and whatnot to help with the pain. And I like to use a various amount of things to help me with my issues, depending on what's going on. Icy hot is fairly good for my pain. Hot isn't always the best option for me for some reason. Cold helps my issues a lot better, but once in a while, if you get some pretty good muscle pains, you're going to need some icy hot. So that's one that I go to every once in a while. And BioFreeze is a pretty good one. It's just cold and it's a cream. It comes in various different things, but the one I have is a cream. You can get it as a roll-on tube, but yeah, it's just cold and it works pretty good for my muscles and especially my knee pain. It can get down there and get that going. And sometimes just a massage will do the trick for especially my shoulder pains. And I am a fan of patchouli massage oil because I just prefer that scent. So obviously any massage oil is going to work, but that's the one that I have and I use quite often for the massages. And when I have a migraine, any basic medicine that says migraine on it is going to work pretty okay. But if you're going to go name brand, Excedrin's pretty good. So as long as it says migraine on it, it'll work like a charm. For me, it works pretty quickly. Sometimes I'll just take basic headache medicine, and that usually will relieve other pains rather than my headaches. It'll help with aches and pains. Another thing I like to use is, it's another lotion, and it's another cold lotion rather than hot and cold, and it is a eucalyptus and spearmint type scent, I suppose, and it works rather well, and I'm quite a fan of it. So, and I also, if I'm gonna do a soak in the bath, I also like eucalyptus and spearmint bath salts. So that's really all there is to it for me and my pain. It's just, I take it day by day, and I take it as it comes, and that's the best that you can do. Just, it's never gonna go away. It's chronic for a reason. Chronic pain, it's here to stay. And yes, I have lost 15 pounds, but losing weight is not the answer to all of life's problems, especially if you have chronic illness, chronic issues. It's not going to make everything all better, magic, all done, no more pain. But losing weight is helpful. It has made my stamina better, so I can do more things and get out there and exercise and help me lose more of the weight. But then I get more of the pain. So what are you gonna do? But it is what it is, and that's just fine, because I don't know any other difference. That's what I've lived with. The pain has always just been there with me all my life, and that's alright. Not a big deal to me. So until next time, bye.